Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Nwaka. First, the highlights. Sector 2 Joint Task Force in Yobe State takes medical outreach to vulnerable persons in the state as part of Nigerian Army Day celebration. Minister of State for Health commissions Infectious Disease Center in Kebbi State as further efforts against COVID-19 spread. And Côte d'Ivoire moves to vaccinate 1 million people in 10 days. The country deploys mobile clinics. The number of confirmed COVID-19 cases in Africa stands at over 5.6 million as of this afternoon. The Africa Centers for Disease Control and Prevention, Africa CDC, the specialized healthcare agency of the 55-member African Union, also reports that the death toll from the pandemic stands at 146,000, while over 4.9 people across the continent have recovered from the disease. South Africa, Morocco, Tunisia, Ethiopia and Egypt are the countries with the most cases on the continent, with South Africa recording the highest COVID-19 cases at over 2 million, while the northern African country Morocco reported 534,797 cases as of today. Well, here's more on the latest in Nigeria.
In continuation of the trend of low daily COVID-19 figures, the NCDC announced 50 new cases reported from 4 states and the FCT in the last 24 hours. Lagos had the highest figures with 31 new cases, followed by Yobe with 11 cases. The FCT recorded 4 cases and 3 cases were reported from Ogun, while River State confirmed 1 case. The latest update includes 0 cases from Sokoto, Plateau, Nasarawa, Oyo, Ekiti and Kano states. Nigeria now has a total of 167,909 confirmed cases. 18 people have been discharged after testing negative to the virus, raising the total number of recoveries to 164,400. According to the NCDC, 1 person has died from COVID-19 complications in the last 24 hours, increasing the fatality toll to 2,122. Presently, there are 1,387 active cases in the country, while over 2.3 million samples have been tested so far. More than 2.4 million eligible Nigerians have been vaccinated with the first dose of the Oxford AstraZeneca vaccine, while over 1.3 million of those vaccinated with the first dose have now received their second dose. According to the National Primary Healthcare Development Agency, Lagos State is topping the list as it now has vaccinated over 237,000 people, followed by the FCT, Kano, Kaduna and Oyo states. In Africa, there are over 5.6 million confirmed cases of COVID-19 and more than 146,000 deaths on the continent. Globally, there are more than 184 million confirmed cases, while deaths are now close to 4 million.
As part of Nigerian Army Day celebration, the Sector 2 Joint Task Force of the Operation Heading K has taken free medical outreach to 3,000 vulnerable persons affected by the Boko Haram insurgency in Yobe State. Flagging off the outreach, the commander Sector 2 Operation Heading K, Brigadier General Adamu Nura, says the program will provide the needed medical tests and support for host communities under the pandemic.
In every conflict, women, children and the elderly are always the hardest hit. It's double jeopardy in Yobe State, with the COVID-19 pandemic taking its toll on the livelihood of the locals. To bring succor to victims who may not be able to afford their hospital bills in the northeastern state, the Nigerian Army is undertaking free medical outreach to 3,000 vulnerable persons in Damaturu, the state capital. According to the commander of the sector, Joint Task Force of the Operation Hadid Kai, the gesture is part of their corporate social responsibility.
We prayed for the country, our leaders, and fallen heroes. Other activities include rendering of our corporate social responsibilities, which gives us the opportunity to reach out to the society, just like we are doing today, as part of civil-military cooperation, out of which this medical reach out is one of them.
The Emir of Damaturu, at whose palace the outreach takes place, says the program has helped his people remarkably and has rekindled the civil-military relationship.
The relationship between the civilians and the military is being brought together. It's in this respect that this service is being rendered, a pre-medical service for the Army Day remembrance. And being human, ill health is there, and it's even part of the protection of lives and property of the citizen, which is one of the basic responsibilities.
The outreach involved temperature checking, diagnosis, and distribution of treated mosquito nets.
The Minister of State for Health, Olorinimbe Mamora, says the federal government will continue to address the healthcare needs of Nigerians and also redouble the efforts in attending to most demanding challenges of citizens in both rural and urban areas. He stated this shortly after commissioning the Infectious Diseases Isolation and Treatment Center and other capital projects at the Federal Medical Center, Benin Kebbi, Kebbi State.
The outbreak of the coronavirus overstretched health systems not only in Nigeria, but also in developed countries. This has elicited social and medical responses from government and private entities to cushion the effect of the virus.
So to the glory of God and for the benefit of the people of this state and beyond, I call this state open to declare this.
To this end, an infectious disease isolation and treatment center is being commissioned at the Federal Medical Center in Benin Kebbi.
Our major challenges, Mr. Minister, is the inadequate manpower to meet up with our current physical development and increasing demand for highly skilled personnel in additional subspecialties of medicine and surgery.
Shortly after the commissioning, the State Minister for Health says the federal government will continue to identify specific healthcare needs of Nigerians and respond to them accordingly.
The whole essence of good governance is to identify the needs of the people and meet those needs. That is good governance. So it doesn't matter where the people come from, whether from the rural, suburban, or the urban areas, from molecular laboratory to isolation ward, to amenity ward, to this incineration center, and all, name it. They are all projects that have in mind the needs of the people.
To declare this waste center commission.
The minister also commissioned other capital projects at the medical center and says the government prioritizes healthcare delivery to the masses.
Let's now talk about vaccinations, and with vaccinations come vaccine passports, or the so-called vaccine passports, which are official documents showing that a person has been fully vaccinated against COVID-19. The European Union has rolled out the digital COVID certificate across member nations and also other regions as travel and other activities open up. Well, joining us for more on this, especially what's happening in Nigeria and Africa, Mr. Tayo Ojuri is the managing partner at Glow Aviation Support Services Limited. He joins us here in Lagos. Welcome to the program.
Hello. Nice to be here.
All right. First, what do you think? Countries coming up with vaccine passports. Do you think this is essential?
It's just the way COVID actually evolved. Each country had to actually look out for itself first, and that's what happened in the early months of COVID. But after a year, and we've gone through this, we have lots of new priorities, new ideas have evolved, and we've seen lots of countries are now giving all that power to WHO to have one source of truth, a source of truth whereby a solution that would address countries across boards. But we've not seen that evolve yet because we still see lots of countries closing down their borders. We saw Saudi Arabia close down its borders just on Sunday. We've seen the increase of third wave happening in South Africa, and now the South Africans can come here into Nigeria. But having said that, the bubble, opening that bubble is necessary because we're social animals, we need to move. So we see science has proven that with vaccination, people are less likely to be infected. So what we've seen is US and the EU having that open bubble of being able to travel to the European Union if you're vaccinated as an American. And within the European Union, you've seen like lots of movement within the 27 member states of having a digital COVID certificate. With that digital COVID certificate, you're able to fill that form, have that certificate. But what we still have that's missing now is the fact that it's not being handled by the states. You have the certificates being handled either by airlines, some by different states, some by different regions or different counties. And what that causes is it makes the system convoluted. It makes the process really laborious, especially for traveling and for moving around. So that's what the challenge is at this point.
So essentially you have countries becoming selfish, and that is due to COVID and of course protecting themselves. And then you have vaccinations that isn't happening at the same time amongst all the regions of the continents of the world. But then you have this COVID certificates. Take Africa, Nigeria, for example. Vaccination is ongoing. So if someone wants to travel from Nigeria and the person has been vaccinated with Covishield, AstraZeneca vaccine, and wants to travel to the EU, for example, how does that work?
It's still not open yet because, like I said earlier, it's not a cross-border. So it's per country. And EU is actually taking that first step. And what EU has done is because they're member nations. The African Union has actually not taken that consolidated step yet, because what we have as the biggest challenge, as at today we had the preview, whereby 1.3 million people have just been vaccinated, have just taken that 2 shots.
Yeah.
What that tells us is that we just have 2% of 200 million people. And even with that 200 million people, let's say 10 million people are travelers. That's what the numbers we have. It's still a low number. So it doesn't give the incentive for the European Union or the Asia, Middle East countries to open up their borders because of the risk of the spread, which is still a challenge.
So when you hear something like the EU listing some of the vaccinations or the vaccines, people that can come or with certain vaccines, and you see that maybe one like Covishield isn't on it, and that's the one we've largely received here in Nigeria. What does that tell you?
That would actually be based on science, because science has shown that whichever maker, it actually went through the due diligence process. So with that due diligence process, it actually validates that process, the product has been real and been effective, and the efficacy of that product to fight whatever strain of the COVID vaccine. So that validation process would actually be a source of truth for passengers to be allowed to travel and be used to, even though they were vaccinated in Nigeria and it was a particular product, as long as it's been validated, especially by WHO as good, and especially by, don't forget, we got that vaccine from UN. COVID. So it was validated. So I think that won't be an issue in the long run.
And WHO is disagreeing. It says it doesn't endorse the making of vaccine passports mandatory for travelers. But finally, the future of travel while we battle the different variants and COVID. What do you think?
The future of travel will be vaccination. Even the future of workforce too will be vaccination. And we'll have to see that evolve in the next passenger travel is not going to evolve. It's not going to pick up till 2023, 2024, third quarter. But what we see the future is we have to see vaccination. But that's still up in the air because the COVID is still in the third wave. We're still expecting a fourth wave. So we can actually put a finger on that pulse and say this is how it's going to be eventually.
All right. We'll see how it happens, but I know one thing is true. Everybody wants COVID to end.
Exactly. We want to go back to the new normal.
Exactly. Thank you so much, Mr. Tayo Ojuri, Managing Partner, Glow Aviation Support Services Limited. Thank you for joining us on the program.
My pleasure.
Still to come, more on the UK Prime Minister's 5-point plan for living with COVID-19 when we return. Please stay with us. Welcome back. The Deputy Governor of Cross River State, Professor Ivara Esu, has called for wider acceptability from citizens on the ongoing COVID-19 vaccination exercise as a means of controlling unprecedented deaths due to infections. He made the charge in Calabar shortly after completing his second dose of the Oxford AstraZeneca vaccine. In the meantime, the Director General of the state's primary healthcare development agency encouraged other leaders to support the state in achieving 100% coverage of the eligible population within the stipulated time.
The first one was, I had some kind of fever. I felt somehow funny in the first 3 days. But I'm sure that this one, the immunity has settled in. So I'm sure that there will be no problem whatsoever. Why do I take it so seriously? To show example, to show that that this vaccine, all the propaganda about this vaccine is not true. That it is something that will help us. If you look at America and Britain, for instance, you know, they're almost getting over the pandemic, because of the number of people who have been vaccinated so far. At least it's not as bad as it used to be. So for us, I think we should follow suit.
So far in Cross River State, we are pleased to see so many Cross Riverians coming out en masse to get themselves vaccinated. I'm also very excited that Cross River State is actually one of the states that is doing very well. Our people have been very receptive, and we are sure that even when at the end of this exercise, we would have almost achieved the 100% coverage that we hope to achieve at the end of the day.
And face masks will no longer be legally required, and distancing rules will be scrapped at the final stage of England's COVID lockdown roadmap. This is coming from UK Prime Minister Boris Johnson. He confirmed the rule of 6 inside private homes will be removed and work-from-home guidance abolished as 16 months of on-off restrictions on daily life end. Now, Scotland, Wales and Northern Ireland are in charge of their own coronavirus rules. The Scottish Government has said it may continue to require masks in certain settings even after 9th of August, when it is hoped the final curves will end. Now, ahead of a review on the 15th of July in Wales, ministers said people would need to learn to live with COVID. Meanwhile, rules in Northern Ireland have just eased, with another review due on July the 8th. Well, Dr. Deji Olaleye is the Specialty Registrar Intensive Care Medicine. He joins us now from the United Kingdom. Thank you for joining us on the program.
Thank you, Millicent.
All right, Doctor. I mean, in the face of rapidly rising cases driven by new, more infectious Delta variants, what do you make of UK's 5-point plan to full easing?
Well, you are right in that there are rising cases, and as we look to lifting those restrictions, as you described, I haven't quite put my finger on it. It's a bit of I have a sort of mixed reaction to it, in terms of, I think that we've vaccinated more than half the population, with 45 million people at least received the first dose. And if not now, then when? So that is there. However, with the lifting of the masks and social distancing regulations in view, that's the bit I'm quite skeptical about. I think that we do not necessarily have to lift those. I think it will be better if we maintain them at least for a while, although the Prime Minister said they're leaving it to individual discretions. So that's my view of it. I think it's mixed for me. I think sooner rather than later, it would be best we took advantage of our vaccination and our testing regimes. And at the same time, I think we should not just lift everything.
With winter coming, I mean, what is the flu season like? And you know, there are certain fears when it comes to that. What role will it play under the COVID-19 pandemic?
I think over the years, winter after winter, we've come to accept that there is what we call the flu season, and I think that's because the cold weather probably drives the transmission of respiratory viruses. So I think it is reasonable to expect that over the course of the winter, the number of COVID cases and possibly hospitalizations will go up. Which makes it more informative that if we lift restrictions in the summer, we would have a sort of test drive to see how the cases would rise and how we manage any potential hospitalizations. And in addition, we have the vaccine. Some steps are being taken in that we expect that people over a certain age will have booster vaccines before the flu season is expected to rise. Over the last year, we had a reduction in the number of influenza, that is flu, apparently because of the steps that were in place to limit COVID as well. They are both respiratory viruses. So I think all these together would inform how we would go into this year's flu season.
What's your take on face masks? Do you think that they should be abolished?
Yeah, I gave a snippet of that earlier. I don't think they should be abolished just yet. I think the evidence is sound that face masks protect and limit the spread of infection. And as long as some people, maybe even a lot of people, will still be infected by whatever variant of COVID is spreading, I think face masks should still be put in place, especially in public places, on public transport, in places in particular where there's a high risk of transmission.
My final question will be human behavior. I mean, that is really key, especially with regards to the MPIs and, you know, even if the variants come and the mutations, what would you expect from, you know, everyone living, even around you as well, also your workplace, as to keeping safe while managing, you know, this pandemic?
I think we've come a long way. It's about 18 months now, and over this period, there's been a lot of behavioral modification. I can say safely that people have changed in the way they don't hug, they avoid contact. There's a lot of social distancing is maintained. As we go into this phase of the nation, I think that people will be sensible. I think people will be sensible. There's less skepticism about COVID, about whether it exists or not. People understand that they have to protect themselves, they have to wash their hands, and I think people would comply. I think the lessons of the last 18 months have been well received, and I think they wouldn't be so easy to shake off.
All right. Thank you so much, Dr. Deji Olale, a Specialty Registrar Intensive Care Medicine. Thank you for that update. Thanks a lot.
You're welcome. Bye-bye.
Now, Ivory Coast has begun sending mobile clinics to markets and other busy areas in its main city, Abidjan, in an effort to turbocharge the vaccination campaign against COVID-19. Now, after administering fewer than 800,000 doses since vaccinations began in March, enough for a single dose for just 3% of the population, Ivorian health authorities are now aiming to inoculate 1 million people over the next 10 days. While acknowledging that it will be a tall order, they hope to pick up the pace by targeting some of Abidjan's most frequented places, especially its open-air markets and, of course, where residents shop for food and clothing. Let's take a look at the global update.
Global Update continues in Côte d'Ivoire, which has begun deploying mobile clinics after setting an ambitious target of vaccinating 1 million people against COVID-19 over the next 10 days. The country's mobile clinics were rolled out on Monday, July 5th, heading for busy parts of the capital, Abidjan, such as markets. Fewer than 800,000 shots have been administered since vaccinations began in March. Over in the French capital, Paris, tourists, mainly from Europe and the United States, have returned, offering a glimmer of hope for businesses that rely on the influx of travelers to one of the world's most visited cities. The flow of tourists to Paris, many of them from Asia and the United States, dried up almost completely last year when the COVID-19 pandemic struck and governments around the world imposed travel restrictions. With infections falling, France is gradually easing restrictions. Japan is preparing to ship millions more doses of the AstraZeneca COVID-19 vaccine to Asian neighbors this week, in continuation of bilateral donations. Japan will send around 1.13 million more doses to Taiwan on Thursday. According to Foreign Minister Toshimitsu Motegi,
A further 1 million doses each will be sent to Thailand, the Philippines and Vietnam this week, following earlier donations to Indonesia and Malaysia. Managing Director at Gavi, Aurelia Guyen, says the COVAX dose sharing facility expects to have 1.9 billion doses of COVID-19 vaccines available by the end of the year, including 1.5 billion earmarked for the poorest countries. It expects a very strong increase in COVID-19 vaccine availability towards the fourth quarter.
Around the world, more contagious variants like the Delta Plus are spreading and a lot of people are still vulnerable. Don't forget to protect yourself and continue to take responsibility. You can visit channelstv.com for more updates. Thank you for watching. I'm Millicent Walker. Stay healthy.